facebook.com/crime victims.
Download the ABC12 mobile app and personalize your news with push alerts like severe weather, school closings, breaking news, and more. You choose the news that matters to you, and we'll make sure you get it first. ABC12 News, your trusted source.
Well, it's the disease that claimed the life of Arizona Senator John McCain and Beau Biden, the son of former Vice President Joe Biden. Glioblastoma is an aggressive and deadly brain cancer that few people overcome. We're going to talk a little bit more about the disease with Dr. Kiran Devisetty. He is a radiation oncologist with the Karmanos Cancer Institute at McLaren Flint. And Doctor, thank you so much for joining us. If you first could just talk a little about exactly what is glioblastoma.
Sure. The full name is known as glioblastoma multiforme, also known as GBM. And this is one of the most aggressive types of brain cancer that we deal with today. This type of cancer originates from a once normal cell that decides to grow abnormally, and when it grows abnormally, it creates a tumor in the brain. And this tumor in the brain will cause pressure in the brain, leading to symptoms. They can be as simple as headaches, nausea, or vomiting, but depending on the size and the location, it can lead to symptoms like seizures, weakness on one side of the body, problems with balance or speech. When patients present with these symptoms, they'll go to their doctor, and obviously it will lead to a brain scan like an MRI, where we see this and determine what needs to be done next.
And so the key is to first see a doctor.
Absolutely, absolutely. When you have progressive symptoms, or what we call neurologic symptoms that are not going away on their own, it's usually concerning and so needs further evaluation.
And one thing I was reading is that this is a very fast and a very aggressive form. And you were just telling me earlier that there's treatment, but there is no cure for this.
Correct. So when we do our scans, we do see a tumor, and the most important treatment is surgery. And when the surgeon goes in, they try to remove all the abnormal tissue while sparing the normal brain. But despite removing everything that the surgeon sees, there is still often cells left behind, almost tentacles extending beyond the tumor. And so we do radiation and chemotherapy afterwards. Unfortunately, it is a very stubborn cancer. Despite the surgery, despite the chemotherapy, despite the radiation, in the majority of the patients, the cancer does come back. And that's why it is considered very aggressive.
What is a typical timeline for someone that might be diagnosed with this? And what's the timeline usually after? I was reading it could be up to a year and a half, maybe.
Correct. So if you look at the average lifespan for patients that are diagnosed, it's somewhere between a year and a year and a half. There are some newer treatments that have come out, such as tumor treatment fields, which is using electromagnetic waves to help slow it down. But even then, the cancer is very stubborn and it comes back. But we're typically talking about a year to year and a half.
All right, Doctor, thank you so much for joining us with all that good information about that. We'll be right back with a check of the forecast. Stay with us.
ABC12 is your official and exclusive broadcast partner for Frankenmuth Auto